Welcome to NGR 6367 deliverable 1. Today we'll talk about headache evaluation in an elderly patient, a case study. Oral debrief. This case is about the diagnosis of a 67-year-old male, proved complex because of his various medical health issues, while he suffered from severe persistent headaches alongside blurred vision and dizziness. In conjunction with the progressive symptoms, the patient's background of hypertension, hyperlipidemia, diabetes, and hypothyroidism raised alarms over secondary headache causes. Such provided invaluable to applying SNOOP mnemonic, considering the critical red flags such as age, progressive nature, and neurological symptoms. The positive CT scan for a possible brain tumor subsequently proved the need for this systemic application and showed the inherent necessity for rigorous evaluation in geriatric patients presenting with new onset of headaches. The two determination was apparently grounded in overwhelming evidence documenting sensitivity with which this instrument identifies secondary headache etiologies. Of particular utility in this case will be the fact that it provided a structured format to assess symptoms in the patient, ensuring that no critical warning signs escapes attention. His blurred vision, together with a worsening headache that exacerbated when he changed position, supported the mnemonic checklist, thus strengthening the imaging requirement. The patient's other major concern was blood pressure elevation, despite his strict adherence to the prescribed antihypertensive therapy, which credence to further investigation for any possible causes of symptoms like increased intracranial pressure or vascular abnormalities. Both to validate the need for a CT scan and to convey the medical urgency to the radiologists and neurologists, thus ensuring prompt diagnosis and treatment. Reflecting on the data collection process, the subject evaluation process executed a thorough assessment of headache features of documenting duration and intensity and accompanying symptoms. However, retrospective analysis revealed that our team underestimated the importance of morning headache severity at the beginning of the assessment process. Morning headache with aggravation at waking is a classic sign of raised intracranial pressure, most commonly due to brain tumors and idiopathic intracranial hypertension. The physical assessment, which is the efficacy and areas of improvement. The physical assessment was thorough, but the fundoscopic examination could have been carried out with improved accuracy. In early signs of papilledema, although mild in this patient, the diagnosis of headache evaluation is relevant and is direct measure to increase intracranial pressure. While CT scan diagnosed the patient's condition, earlier detection of optic disc symptoms would have possibly shortened the diagnostic timeline. This has fortified the need for improvement in the area of fundoscopic examination with special emphasis on early recognition of papilledema. Attending a workshop aimed at training optic disc assessment and practicing under mentorship from experienced clinicians will greatly benefit the undertaking to better skills. Furthermore, the routine performance of fundoscopic examination in patients who complain of headache without any obvious case, especially those with red flags, should become standard so as to timely detect intracranial pressure. In conclusion, this case highlighted the necessity of a thorough assessment for older patients presenting with headache. The diagnosis approach worked well, developing fundoscopic competence alongside standardized patient interviews would boost future assessment quality. The management of similar cases will need continuous learning alongside collaborative effort with neurology professionals. Thank you for listening.